Hello everybody and welcome to our presentation today for 526. Our specific subgroup that we've chosen is Physio for farmers specifically, and we're group 15, and we hope you guys like the presentation. So first I'm going to kind of explain our choice. So it's farmers with chronic conditions. Think about people like with osteoarthritis, lower back pain, neurological conditions. So the main issue is that there's an ongoing problem with farmers in rural Alberta and having limited access to resources like physio compared to urban residents, for example. This can be for a lot of reasons, such as travel distance to the nearest clinics. It's more difficult for farmers, especially in rural areas, to find access to that. The lack of physios in those regions, investment for physio as farmers, it takes away from their farming time, and the mindset of kind of farmers out there as well. We can consider they have that more tough it out mindset rather than just going to get help. And we'll move on to the next slide now.
To address these issues, we're proposing a hybrid model using mobile physiotherapy units, telehealth, and community hubs. First, the mobile PT units would rotate through rural regions, providing in-person visits once every 4 weeks. With this approach, we estimate we could reliably serve over 300 farms. These visits would focus on assessments, exercise progressions, ergonomic advice, and personalized management plans. Between these visits, farmers would receive 2 telehealth check-ins, one in the first week to address questions from the previous session, and one in the third week to determine whether an in-person visit is required for the following week. This helps us to prioritize higher need farms and maintain consistent follow-up. For farmers who can't access telehealth, we would establish local community hubs, either in libraries or in community centers, equipped with simple telehealth stations. This would help to reduce their travel time and ensure that no one is excluded. Finally, we'd provide brochures on common chronic conditions and farm-specific safety strategies. Overall, this model is flexible, scalable, and designed to meet farmers where they are.
So, for us to implement our plan, we would need staff as well as equipment. Some staffing needs include 1 PT and 1 PTA per van. This helps ensure that there is enough expert help available for assessment, as well as treatment like modalities or teaching exercises where appropriate. We require 2 to 3 PTs managing remote telehealth appointments to help us ensure patients are able to schedule appointments for follow-ups and ask questions when they need. This would likely be part-time and appointment-based for the physiotherapists we appoint. Overall, we would need a team of 15 plus staff and administration to help support and implement this plan. We would also like to require equipment to serve rural areas. As mentioned, we would use vans to travel and perform appointments in the van itself, like a traveling clinic of sorts. So 5 vehicles and equipment including plinths, exercise brochures, and exercise equipment are the basic starting tools we would need to perform these appointments. With all these in mind, we are looking at a total starting cost of approximately $250,000 plus yearly staffing around $1 million. This does assume that we would be buying all the equipment new and not leasing or renting any vehicles, but these are the starting costs we have in mind.
When we look at the benefits of bringing mobile physiotherapy directly to rural farms, there are 3 major impacts that we expect. First, we can reduce emergency room visits and long stays. Farmers often push through pain or delay care because of distance and time constraints. By providing early assessment and treatment on-site, we can prevent minor issues from becoming long-term complications of chronic conditions. Second, mobile physiotherapy helps streamline rural healthcare. Rural hospitals have emergency departments that are already stretched thin, and by catching complications early and managing conditions proactively in the community, we can decrease the burden on the system and keep farmers healthier and working without needing crisis-level care. Finally, our service strengthens family support. Farming is a family-centered lifestyle, and mobile care allows us to involve family members directly in education, safety planning, and rehabilitation. This increases the effectiveness of care and ensures everyone feels confident in supporting recovery at home. Overall, mobile physiotherapy meets farmers where they are, supports their health in a practical and accessible way, and reduces strain on rural healthcare systems.